Alcohol is having a massive impact on public health. Alcohol is our favorite drug. Most of us use it for enjoyment, but for some of us, it is a serious problem. In fact, alcohol is causing more harm than illegal drugs such as cannabis and heroin. Many patients are becoming involved in a revolving door of attending A&E and being admitted to hospital. And this is costly because they are being admitted either because they are intoxicated with alcohol and also because they are getting involved in accidents because of their alcohol consumption. Alcohol is having also a massive impact on the community and society as a whole. Domestic violence, antisocial behavior, and violence in general in the community is on the increase because of alcohol. There is also the set of people who are using alcohol for a prolonged period of time, heavily using alcohol. This is causing heart disease, liver disease, and cancers, including liver cancer as well as breast cancer.
The cost implications of liver failure for the NHS are very important. Patients presenting with liver failure consume a lot of hospital resource, are often on the intensive care unit for days and weeks, and then spend time in hospital recovering to the point that they can be discharged. The concern is that they may well be readmitted again if they don't stop drinking, and we see the same thing time after time. If they eventually become candidates for liver transplantation, then that is also an incredibly expensive undertaking. One group of people who we are increasingly concerned about is the young men and women. We're seeing increasing numbers of people in their 20s and 30s admitted to hospital with liver failure as a direct consequence of alcohol. If this was an infectious disease or a cancer, it would have a much higher profile.
I usually drink socialising with friends, going out for dinner with my boyfriend, and unwinding after work as well. I have a couple of glasses of wine. I think when it comes to drinking and my health, I probably am quite ignorant in a way that I choose to ignore those risks, and I'd rather carry on drinking and tend to ignore what it's potentially doing to my body.
The impact that alcohol has on the ambulance service is huge actually. The increased demand of these incidences has a huge effect on our service and indeed the local hospitals.
Something like 35% of patients coming to the emergency department year on year have alcohol-related illness or injury. This rate rises to 70% on a Friday and Saturday night, as we'd expect.
Admittedly, I think my personal consumption of alcohol could be a lot less. I think things like raising prices wouldn't deter me from going to a pub. I think I'd probably drink more at home now and probably drink more bottles of wine than I would do in a pub because it's cheaper. So I'm not really sure what kind of deterrent would actually stop people from drinking alcohol.
On a day-to-day 24-hour service, we have so many patients that are coming through either still intoxicated, in police custody, and just very, very difficult to manage. I've seen them being very aggressive towards our nursing staff, towards other patients. I think it's really intimidating for relatives to come in and see their loved ones being nursed in an environment with those very challenging patients. I think also there's a lot of patients that are frequent attenders that come in and they'll be given half a detox for a day and then they'll abscond and then they'll come back through A&E again 2 days later. And that's draining on the resources. We have to notify security, we have to involve the police. I think also just the violence that I've experienced towards myself and towards other nurses is very difficult to manage.
The impact of alcohol on Wandsworth has been addressed at the very outset of the Licensing Act coming in. What we did was that we realised we did not have one central town centre like most local authorities, but we had 5 town centres. And the effect of these 5 town centres is that there's very close contact between residents and the commercial premises selling alcohol. So Wandsworth decided on a licensing policy that included hours of sale. The effect of this is that, of course, we have not got the fueled drinking areas that other local authorities suffer from. We haven't got the crime and disorder in most of our town centres, and that has been a very good effect of the policy. But of course, we can do a lot more. We're not complacent.
I think a good solution to have in any hospital is to have a specific alcohol liaison team. Since I've started working in my current position as an alcohol liaison nurse, I think just having that specialist there to have the time to look into the patients to see if they're already in services and to link up with those services, and also to advise on appropriate medication management of the patient so that the withdrawals aren't too hard to manage. I think that that's been a really positive thing.
A&E departments are not the most appropriate places for these patients, and we are working hard with Wandsworth Borough Council and NHS Wandsworth in order to maybe take these patients direct to open access treatment centres in the borough, and we have 4 such centres at the moment. The service also have to operate a booze bus in central London at particularly busy periods, that is on weekends and in the run-up to Christmas, and we have received further funding from NHS London to operate those up until the end of March.
We need to understand the needs of the most vulnerable in society, like street drinkers and homeless people. Alcohol companies are using very clever marketing for all ages to promote alcohol consumption, and we need to be aware of this manipulation and start a movement to address that. We've done it for smoking, and we can do it for alcohol.
To address these issues, the emergency department plays its part, but it also has to be a multi-agency approach. The emergency department obviously treats the patients. We can instigate short interventions, which are effectively psychological interventions, using alcohol workers to pick up these patients and try and address their problem drinking. We can also provide information anonymously to external agencies regarding where people are drinking, how they are drinking, what they are drinking. The other agencies that we need to involve include the Metropolitan Police, because crime is very much associated with alcohol, together with General Practice, the London Ambulance Service, Public Health, and indeed the licensing officers locally.
What we're trying to do now is to ensure that people actually know what their rights are under both the Licensing Act and also under some of the other legislation surrounding it. We also work very closely with our partners, the police, the fire brigade, town centre managers, health and safety, licensing team, and other areas who have an impact on the alcohol sales. After one of the liaison meetings, on intelligence gathered, we discovered that there was allegations of underage sales in the borough. So our trading standards officers went out and carried out some test purchases using children. The idea being that if they sell the alcohol, then the police will issue a fixed penalty notice, and trading standards officers will call for a review of the licence. Once a review takes place, they can have conditions attached to their licence to ensure that they will not sell to children again.
We as a service, you know, we're not out there to be killjoys, and we're not out there to stop people having a good time. But all we would urge is that people drink sensibly and they drink responsibly for the sake of their own health.